my friend George a hard time. Anyway, I would like to introduce the moderator for this session, Pak George Iwan Marantika. Pak George is the President Director of SIXCAP Gamma Technology, which is a joint venture company between SIXCAP Group and UGM. Pak George and I have go back many years. I won't tell you how far back, but because I'll give away our age. But we've known each other for at least 2 decades, yeah. And Pak George has been involved in many different areas of life. He's an academic. He's an entrepreneur, politician. He basically runs Jogja, but he's also a very insightful thinker on many of the issues that we face as Indonesians and as we move forward in terms of innovation and how we can bring greater benefits to the Indonesian people. So without further ado, I will hand it over to Pak George to invite your panel and to get the session going.
Thank you, Pak Shweb. This panel is a panel that will discuss the health sector in Indonesia. And as all of you know, Indonesia is coming into as a middle-income country. 2 major sectors that is very fundamental is the education sector and the health sector. And as we move into this trajectory, this topic will discuss preventive healthcare in the digitalization era, or in Indonesia's rise as a digital economy. And with that, we have several speakers here today. First of all, we have Dr. Andreasta Meliala. Could you come to the floor, Andre? And he is the chairman of the Hospital Management Graduate Program in the University of Gadjah Mada. And secondly, we have Mr. Steve Aditya, who is the leader of Life and Sciences Healthcare from Deloitte, Indonesia. Steve. We have also from BioPay, a digital preventive healthcare digital company that's part of SIXCAP Group in Singapore, Mrs. Shiying Gan, the CEO of BioPay. And Mr. Cliff Lee, the managing director of BioPay. We also have from the University of Gadjah Mada, from the School of Medicine, so from the Medical School of Gadjah Mada, Dr. Lutfan Lazuardi, PhD. And also from the industry, the hospital industry, from the Academic Hospital of Gadjah Mada, Professor Dr. Herini. So we have about 1 hour and 15 minutes. This will be an interactive dialogue, and then we would entertain questions from the audience. To begin with, I would like to ask 2 gentlemen, first to give a 5-minute outlook of where the sector is at, especially the health sector in Indonesia, through the perspective of digitalization. And first, I would like to ask Mr. Steve Aditya from Deloitte, Indonesia, to give his comment on that outlook, about a 5-10 minute comment. And then from the academic perspective, that will be Dr. Andreasta Meliala will follow after Steve. Please, Pak Steve, could you give us an outlook where the healthcare sector in Indonesia stands in terms of digitalization at this time and day?
Okay. So, thank you, Pak George. Thank you, ladies and gentlemen. I think when we talk about the Indonesian digitalization, especially in the healthcare sector, we are not able to move away from what happened at the global level as well. So we see the life science sector in global level are currently under pressure. Number one is because of the changing of the business model. For example, coming from big therapy into targeted therapy, into blockbuster, into smaller launches that's happening in several countries or several regions, for example. And the pressure also not coming from the existence of this company itself, but also coming, for example, from the payer. More and more countries are moving from the out-of-pocket, moving to the payer market. For example, Indonesia, what's happening in Indonesia. So we're implementing BPJS now starting 2014, and we are expected that by 2019, about 250 million of Indonesian population will be covered by BPJS. On the other hand, we also see the evolvement of the patient itself. So more and more are patients moving into a customer-centric thinking. We have a study within Deloitte, what we call as a health hub, which is basically looking at the connection between home, human, and hospital. And we see that the development there are interacting within one another. Now, moving to Indonesian market as we speak now, I think we know that the penetration of the internet, the usage of the smartphones among the youngs, among all of us we are in the room, is getting higher every day. But I think when we see the usage of that smartphones, most of the people in Indonesia are still using it, for example, for chat, for social media, for example. So in terms of awareness of using preventive healthcare among the users of the smartphones who have access to the internet, is also something that we need to look at to review as well. On the other hand, we also see in terms of the regulations of the medical or wearable health that we're going to speak now. We have regulations coming from back that until 1966, which is PP number 10. We have Permenkes number 269, which is talk about the rekam medis, and also we talk about the obligation of confidentiality, for example. So I think when we go into more and more into the healthcare or digital space, number one, we will look into the infrastructure. Number two, we're going to the awareness. But number two, I think we also need to look into the security or the safety of the data patient as well. We know that the profilation of the e-medical records, for example, is a hot topic within the healthcare sector. So this is something we need to look at as well within the players in the market.
So thank you, Mr. Chair. In 2019, Indonesia planned to have universal health coverage to cover 250 million people to be included in the social security scheme. And within this target, currently we have multiple burden of disease, since we still have infectious disease, degenerative disease, lifestyle related, and also other diseases, new emerging disease, which is prominent in this country. And on the other hand, from the supply side, we're still having kind of lack of specialists, medical specialists, and also in some primary care, there are no medical doctors available. So within this context, we try to have some kind of new strategy to achieve these goals, because the regime, the current government, they insist to have this by 2019. And for a specific issue, kind of chronic disease management, and also lack of ineffective health promotion program are still persist. And Ministry of Health up to the district health office are trying to solve this problem. And one paper written by Wildman, and is still in press and will be published soon. They mentioned about assisted living technology. This is a kind of information technology approach to support the health intervention, and it aims at increasing the health system performance. And with this assisted living technology, is very useful for this country, because we are facing kind of increasingly aging population, and also skyrocketing price of health and social care cost. And with this ALT, we will have some kind of telehealth and telecare, and this is very useful to reduce the health budget of the government as well as the people. And to whom we should aim at the ALT. We have to use this for older population, and also the potentially vulnerable youngsters population, because lifestyle-related disease is also rampant currently. And in current strategy, technology is not really well used. So if we have some kind of intervention to promote the healthy lifestyle to the risky population, and also to improve the effectiveness of health planning, as we know that some part of Indonesia, in the eastern part, we have some kind of a problem in the logistic and also human resource, so lack of resources. And then in terms of financing issues, since this is a kind of social health insurance for all people, so the government already allocated the money for all. But then what is it for if the resource is not available? So with this technology, we can also help the government to reach the unreached people, particularly in the remote area. I think that's my outlook. Mr. Chair, thank you.
So Mr. Steve from Deloitte has shared with us that technology of wearables and digitalization in the health sector will be the future. And Dr. Andre also shared that telemedicine could be actually near in Indonesia, in the Indonesia's near future. And you would predict telemedicine in 2025, 2030. And so 2017, we can start? We can start in 2017. And therefore, with that, we have here today from the supplier side. Yeah? So that was the outlook. But from the supplier side, we have here today Ms. Xi Yinggan, the COO of BioPay. And she can share from the perspective of the digital healthcare technology and preventive healthcare what BioPay is all about and how it can be a solution to Indonesia. After Ms. Xi Yinggan, Mr. Cliff Lee, who is the managing director of BioPay, will share about the collaboration with the University of Gadjah Mada to provide a Indonesian-led preventive healthcare digitalization technology made with BioPay in Indonesia. So with that, I will allow Mrs. Xi Yinggan to share a little bit about BioPay and how that can be the solution of the outlook that Mr. Steve and Dr. Andre had mentioned. Xi?
Thank you, Pak George. Yes, I agree completely with the outlook provided by Pak Steve and Dr. Andreas. I think the world today is in need of a transformation shift towards preventive healthcare. We need a revolution in terms of consumer healthcare delivery. And I think BioPay was designed to do this. So how BioPay does this is through the co-creation with partners, ecosystem partners. We tie together with big pharmaceutical companies, with big data analytics, network of doctors, patients, and everybody contribute their core competence and bring together more value, help to drive decision, evidence-based decision for consumers to bring about better quality and more affordable healthcare. And we want to do this starting from Indonesia and spread this to the rest of the world, because I think preventive healthcare is something that is possible with today's digital technology. I mean, we do that in almost everything that we do now, from ordering a car in terms of transport, doing grocery shopping, and I mean, everything can be done at the tap of your fingers. So there's no reason why technology is not able to help us make healthcare a lot more convenient and accessible to us. So BioPay is doing an initiative with Indonesia, working through with University Gadjah Mada to launch Nusa Health, which is a digital healthcare initiative starting pilot trial with the whole of Central Java, and then we hope to launch it throughout Indonesia. And this is the first time anywhere in the world today we are able to carry out and formulate comprehensive big data sets, big data healthcare sets across populations. And using big data analytics, which is one of SIXCAP's core competence, we're able to generate real value for consumers like you and me. So to bring about not just healthcare in terms of curing sickness, but even before we get into sickness, before we even become sick ourselves, we can be healthy. So we don't even need to see the doctor. So I think that's the vision behind BioPay. Maybe Cliff can add on.